So I'll introduce our speakers, Dr. Kenowsky and Dr. Bonnie Marks, shortly, and then we'll get going on the topic. So we are going to take a summer hiatus for a few months, and we will be resuming sometime in the fall, probably October, maybe September, and these are some of the topics that we've got in mind for the next series. Greatest advances in cardiology in the past 10 years. I think I'm going to do that. We're going to have an update on diabetes. There are so many drugs coming out all the time. And we're going to give you an update on the latest and greatest therapies for diabetes. The most important thing, and never forget that, is lifestyle changes for treating so many diseases. And diabetes is really close to the top of that list. That means exercise and losing weight and eating a healthy diet. New strategies for managing obesity, and that would be another interesting topic. So this is for those of you who want to keep in touch with us. We have a website. We have an email where you'll find out what's coming up. You just have to give us your email address, give it to Anya, and then you'll get an email about what's coming up. And of course, we're actually on Twitter as well. Here are the past topics. I'm very proud of these topics. I'm not going to go read them, but you can see that we've covered so many different areas, and I actually said to Anya the other day, I think we're going to have to start repeating some of these, because I think we've covered almost everything there is to cover in the world of preventative medicine, and we're going to start doing some of these again because you'll get the latest updates. If there's a topic that you would like us to do or to present, please come and let us know, let me know, let Anya know, and we'll do our best. We always find absolute experts and top experts in a field to present information to you. And we are very blessed to be at NYU, where we actually have truly amazing top experts in every field. So it's very rare that I have to go outside of the NYU system to find people to come here and present. And they give of their time freely, they're generous about it, and I'm really grateful to both of you tonight. Let me just introduce you. I don't want to take too much time reading their CVs because they're so long. And it goes into the most important thing, which is the information they give. But our first speaker is Sunnie Kenowsky, and she's an experienced Alzheimer caregiver, the co-director of the Zachary and Elizabeth M. Fisher Alzheimer Disease Education and Resources Program at the NYU School of Medicine. She's held this position since 1995. She's a clinical instructor. She is an Alzheimer and related disorders care specialist. She's spoken nationally and internationally. She's written and co-authored many articles on the care of Alzheimer's patients. She's an absolute expert on Alzheimer's disease, and this really caught my attention. She was a caregiving expert at WLIW Live Call-In and Ask the Expert show following the airing, and the documentary was Alzheimer's is Their Hope. And she had another documentary, I Remember Better When I Paint. So Sunnie is an absolute expert on dementia and Alzheimer's dementia. She got the Department of the Navy awarded her a Medal for Meritorious Public Service as a strong supporter of the United States Naval Service for significant humanitarian service in the research and treatment of Alzheimer's disease. So I'm delighted to welcome Sunnie, and as soon as she's done, then I'll welcome our next speaker, Bonnie. And we look forward to a wonderful program. Thank you, Sunnie.
Hi, thank you for that introduction. I'm very excited to be here today talking about this topic. I think it's a very fascinating topic, and I hope that you'll agree with me. There are amazing links between cardiovascular disease health and Alzheimer's disease. And I see on the previous topic list that some of them you've already heard about, and so you'll probably be knowledgeable about some of what I'm going to be talking about today. The first thing is that it's always good to have an understanding of the brain, just in general, to understand that it's made up of three parts: the cerebrum, the cerebrum, which is the big part, the cerebellum, and then the brain stem. And inside the nervous system in the brain, there are just billions and billions of nerve cells, and we call those neurons. Each has this long process here, the long process there, which we call an axon, And you can see that the axon comes down and then it starts to interact at this junction point with another nerve cell. And just for future understanding, this we call a synapse. And that is the way that your nerves communicate the information that you might receive in some fashion, whether it's something you see or something that you hear or something that you feel. And what happens is that when a signal comes down, it will cause the release of chemicals in here that we call neurotransmitters. And I only mention that because that is actually the only treatment that we really have so far for Alzheimer's is impacting that. So to stay healthy, the nerve cells have to be able to communicate with each other properly. They have to be able to repair themselves when they have problems, and they have to be able to carry out metabolism. And Alzheimer's interrupts all these processes. And it actually leads to the loss of those little synapses that we talked about, which is how the brain connects. And it does that by, we have two hallmark lesions that actually cause all the problems. One is called the beta amyloid plaque, and the other is called a neurofibrillary tangle. And I won't go into all the details of this, but these two lesions are the primary problem that we see. We really don't know what causes Alzheimer's. I wish I could stand here and tell you that it's this reason or that reason, but we haven't really fully elucidated all of the mechanisms. We do know in early onset, which we call familiar Alzheimer's disease, that it's due to a genetic inheritance, and we have mutations in certain genes, and those, for the most part, affect the processing of that one lesion that I called beta amyloid plaque. And that also is what we tend to call sort of the trash of the brain, in that when beta amyloid accumulates, it starts to gum things up. But it is present normally, even with aging. In later onset Alzheimer's, we see some influence from genetic, but also lifestyle and environmental factors that come into play too. And we also have the problem that with early onset, not all of it is due to genetic causes. So you can test for each of those genes that we have a problem in, and we'll find people that have early onset Alzheimer's, which occurs in the 30s to 60s, and they won't have those genes or any of the other main problems. So we know that there's a lot more going on than than we know. So in the late onset, there is a genetic influence of ApoE. And I'm sure that you guys have heard about that in terms of shuttling cholesterol around in the body. And if a person has a form of ApoE2, then that protects them, because the ApoE2 cannot bind to the LDL, or the lousy cholesterol, as I tend to call it. If you have two copies of the ApoE3, then it doesn't have any influence on things one way or the other in particular. And if you have two copies of ApoE4, that's when you start to see a problem and a risk factor for Alzheimer's disease. And we're learning all new kinds of things about ApoE4. One is that it actually can increase our susceptibility to viruses and bacteria. It's especially associated with the herpes simplex virus, which if anybody's had a cold sore, then you know that's related. And it tends to cause our body to produce more of the ApoE4. So the reason that I mention that is that one of the causes of Alzheimer's that we're thinking may be applicable is that it actually has been shown that we have different viruses and bacteria and even fungus that have been seen in association with these two hallmark lesions of Alzheimer's in people's brains when they've done autopsies. So the good news is that lifestyle and environment is also a big part of what's going on in Alzheimer's disease, so that we have a real great chance of modifying its course. So it's just important also to understand that it's rare to have Alzheimer's by itself, but that 50 to 84% of aged Alzheimer brains also have cerebrovascular disease. And that beta amyloid that we talked about earlier, that tends to get deposited in the small cerebral blood vessels. And so that also plays a part of it. But the greatest risk factor for Alzheimer's is actually age. And it's very hard to tease apart what's normal aging and what is the beginning of dementia. And the reason for that is that people who are cognitively normal and are old also have plaques and tangles in their brain. So we're not quite sure, what we make of that, and at what time does it become, what time does it become disease, and when is it just an aging process itself? We also find that that African Americans are 2 times as likely as Caucasians to develop Alzheimer's, and Hispanics are 1.5 times likely to develop it over older white adults. And then there's family history. If you have a first-degree relative, which is a mother, father, a sibling, that has Alzheimer's, then late onset or sporadic form of Alzheimer's, then you also have an increased risk of developing it yourself. So there's a lot of things that go into it, and you can see over on the left-hand side of the slide that also if you're a woman, you're at greater risk. And Alzheimer's affects more women than men. And it's also been associated with Down syndrome. So there are a lot of modifiable risk factors for Alzheimer's disease. And we'll, for the most part, just be talking about the ones that are applicable to the lifestyle changes or that we see in common with heart disease and cerebrovascular disease. One thing that I would like to mention on here is the cognitive reserve, and that is really, really important because cognitive reserve is very protective for people that have a good cognitive reserve. They will either have a delayed onset or less of a risk of onset of Alzheimer's disease. So that's where some of the lifestyle changes are going to be coming into play. And sleep is also very important. So some of the shared risk factors that we have hypertension during midlife. We tend to get a little bit of vessel damage. Smoking, the same problem. Hypercholesterolemia, we talked about the ApoE4, and you know that can block your blood vessels and cause havoc. And then we have age, which we spoke about, and hyperhomocystinemia, and that basically is an independent factor that is also associated with affecting your vitamin B levels, and it also affects your risk of getting stroke. So an elevated homocysteine level means that you have an independent double risk of developing Alzheimer's, unfortunately. But the good news is that it's very modifiable. So we also have age that we talked about, diabetes, and I'll get to that in a moment. We already talked about that ApoE4 isoforms as a risk. And then there's being overweight. And people who are obese in their middle of their life have a threefold increased risk of Alzheimer's. And if you're not obese but you're overweight, then you have a twofold increased risk of Alzheimer's. So, and then later on, if you already have dementia and you're overweight, then that weight becomes protective, because there's a problem with people when they develop Alzheimer's of losing weight and not being able to maintain their metabolism appropriately. And also we know there have been lots and lots of studies that have said that if we decrease our caloric intake, then that will extend our life as well. So one of the big ties is that the brain is very, very vascular. So when we have a process that is damaging those blood vessels, you can see that it's also affecting how nutrients and oxygen may be getting to the brain itself. So this is actually a very complex interaction of all of these things that we have talked about, and I just put that up there to kind of illustrate that, because we can't really go through everything. But what happens in the beginning of Alzheimer's that we do know is that there are these problems with getting enough blood flow to the brain and throughout the brain, and that there's an increase and a decrease in metabolism. And glucose, which is one of the main energy sources of our body, is affected in the beginning. So we have a problem with the brain that's similar to a diabetes of the brain, in that the brain is similar to being insulin resistant, and things are not moving along like they would with diabetes of the body, but that's because it's in the brain. So that is affecting the metabolism and the glucose in the beginning. So, and along with that, we have this thing that's called white matter disease. And white matter is making up the deepest parts of the brain, and there's millions of nerve fibers, or those axons that we talked about, that are made up of white myelin, and they're connecting our brain and our spinal cord, and they're helping us to communicate. And they also are responsible for helping us to think quickly, to maintain our balance, not fall, maintain urinary continence, to focus, to be able to problem solve, and to be able to walk straight. So white matter disease, which happens oftentimes in the beginning, is a complicating factor, because it can also lead to cognitive impairment. And cognitive impairment is one of the biggest risk factors for Alzheimer's disease. We're not really sure about everything that causes white matter disease, but we do know that aging and many different conditions such as diabetes, Parkinson's, injuries and toxins, and also the same blood vessel problems that lead to heart trouble or strokes. We have to be concerned with high blood pressure, hypercholesterolemia, ongoing blood vessel inflammation, and even smoking can lead to that. So for a clinical diagnosis of Alzheimer's, we have to have cognitive impairment in 2 domains and dementia. And that means that the cognitive impairment is interfering with your daily life. And the really interesting thing is that Alzheimer's follows a characteristic progressive course. And we measure that by something that we call the Global Deterioration Scale, which just means how the person deteriorates overall. And we can also check how that person changes in their functioning in a global sense. So the first stage is actually the normal person who doesn't have any objective or subjective symptoms of cognitive or functional decline, and they're healthy. Stage 2 is also the healthy individual, but they may have some complaints about the fact that they're forgetting where they place things more frequently. They might not remember names as well as they used to. They might have difficulty finding correct words. But still, if you were to evaluate them, they would be normal, and they can hold their job normally. But they just have complaints themselves. The third stage is what we call mild cognitive impairment or pre-dementia, and that's when people start noticing that you're having difficulty if you're working, that you are having word and name finding problems, and that you may have lost things that are important and are valuable, or you may have gotten lost when traveling somewhere. And if we were to test you, you would have a concentration deficit, not be able to have the same insight that you had in previous times, and you may also have some mood changes and a generalized slowing of psychological and physical activity, and a lot of people experience weight loss. And then the fourth stage is actually what we call the beginning of Alzheimer's, and at that point you're having mistakes in major recent events, facts and figures, and that's causing problems in your ability to handle your personal finances and your job. So you won't be able to shop, plan, and orchestrate a holiday meal, so people may come over for Thanksgiving, but you couldn't quite get it all together. And most people in that stage will be aware of their problems, but they'll deny it. And the fifth stage is actually the middle stage, and at that point people can no longer survive independently in the community. And this is the stage where a lot of the behavioral and psychological symptoms start occurring, which you see up here on this slide. And we also mark it by the fact that the person can no longer pick out their clothes appropriately for the season. So this, you might see people having trouble wearing warm enough clothes for winter. And stage 6, people develop problems with dressing, bathing, toileting, and maintaining continence. And still have a lot of behavioral problems. And in stage 7, that's the end stage where people lose the ability to speak, to walk, to sit up, and smile. And the interesting part about this is that a person with Alzheimer's loses their abilities in the reverse order that a person growing up acquires them. And if we were to look at the changes that we see in the brain, we actually see that they mirror development as well in a degenerative way. So that's just an important understanding of the disease, because we can use that in knowing how to manage people that have Alzheimer's. We can approximate a developmental age, as you see here on the right, which would correspond to the stage of Alzheimer's where they've lost those abilities. And then we can use that information to plan and carry out activities and cognitive stimulation with the person and engage them in therapies. And unfortunately, there isn't a lot of treatment when it comes to Alzheimer's disease that's been terrifically successful. And actually, the eco-biopsychosocial programs have been proven to be more effective than the drugs and the other medications that we have at this point. For instance, the comprehensive individualized person-centered management program that I developed we tested it using the same medical measures that they used to bring Namenda, which is a drug, through the FDA for approval. And we found that on those same measures of global functioning, cognition, and behavior, that the management program was 966% additionally effective to Namenda. So there's lots of hope in lifestyle changes, because that's basically a lot of what the management program is. And when we see that it's working in almost severe end-stage people with Alzheimer's, I think that gives us tremendous hope for early changes. So we do have a few treatments. We have a Namenda, which I mentioned, which stops some of the cytotoxicity that occurs in the brain. And then we have Reminil, Aricept, and Exelon. And what those are the acetylcholine esterase inhibitors, and you surely don't need to remember that name. But those are drugs that affect those chemicals that I showed you in the beginning in the synapses. These medications help you have more of those. There are also supplements now that can increase your neurotransmitters, and there have been a few studies where they're available. There's a product on the market called Cebria, and a few studies have been done on that, and it does seem to help, but they need more research to prove it. It does seem to help normal people recall names and things a little bit better. So in any case, these treatments that we have for Alzheimer's can help improve people's abilities to carry out activities for a short time period, but they don't really stop or reverse Alzheimer's. And maybe that's because we still need to delineate and understand fully everything that's causing it, because we really don't know, and we don't really know how everything interplays together. So, and another problem is that we need people to join studies. So I hope that you'll all be encouraged and check out the research that we have ongoing. There are a lot of research into different areas, into inflammation, into different things. And we actually have a study where we're helping that normal person by offering them a neurogenesis enhancer, which means that it's a medication that's very safe and been on the market, and it helps you grow new brain cells, and it also helps you take out the trash, the brain trash. So that's what we're working on, and there are a lot of other studies listed on the handout that I had in the back. So I think that you've seen that there's really growing evidence to support that if we live a heart-healthy life, then we'll have a healthy brain as well. And if we make beneficial lifestyle choices, which Dr. Marks is going to cover in greater detail, we see that we can actually attenuate modifiable risks of vascular and those metabolic conditions that we talked about. And we do get an improvement in cognition, because we do get the production of new brain cells, we get the production of new synapses that we had talked about, and we can even get the production of new blood vessels. So those regions of the brain that are especially changeable and are vulnerable to things like stress are also really amenable to interventions. So take it seriously when Dr. Marks goes through, some methods to reduce your stress. And I just wanted to mention quickly that there is a specific diet that we recommend. It's called the MIND diet, Mediterranean DASH, and it's been shown to lower your risk of Alzheimer's by 54% if you adhere to it. And even those who could only adhere to it in a less rigorous fashion decreased their risk by 35%. And it also lowered the risk of coronary artery disease, hypertension, cerebral vascular accidents. So I have here on the slides, which you can see, it's mostly whole grains, dark leafy green vegetables, spinach, kale, broccoli, berries, nuts, not too much carbs and not high fat except for healthy fat. And it includes a lot of fish. It has to be healthy fish, which means that at this point in time it should be from the northern waters up by Alaska and Norway, because most of the other waters are polluted and your fish will have heavy metals which are toxic to the brain. So you want to have the fatty fishes, salmon, halibut, tuna, things like that. And olive oil has actually been found to have what they call an Alzheimer's preventative itself. And if you consume it when it's raw, it enhances healthy lipoprotein or your healthy cholesterol, and it helps scrub off the cholesterol from your veins. So, and wine itself is also important, but you have to be sure not to overdrink, because if you overdrink, then you're affecting your blood pressure. And it's only wine that's been found protective, and particularly red wine. So then we, of course, have the foods to avoid that you all know about, and trying to go with grass-fed sources if you are going to eat any of those things like cheese or milk or beef. So it's really important, in order to delay the onset, that you visit your doctor and that you have your levels checked. And all of your doctors, your primary care doctor, will be able to do that. Also, to avoid brain injury by wearing head helmets, by stopping smoking and stopping drinking if you're drinking too much, and more than 1 5-ounce glass of red wine is too much for the brain. And then also treat all of those medical problems that we talked about that can worsen dementia, and avoid drugs that can cause cognitive impairment. We've found that those drugs that work against those neurotransmitters, that things like Dimetap, chlortrimeton, they really cause problems for the brain. And if you take them in a regular fashion for more than or equal to 3 years, that's associated with a 54% higher risk of dementia. And also some of the sleep medicine, Sinequan, Trazodone, and Remeron as well. You have to talk with your doctor about these medications. Sometimes you may need to take them, but your doctor will keep you on it for the shortest period of time and make sure that you're, only taking it when need be. And I think the most important thing is just to avoid being a couch potato. And so now Dr. Marks is going to talk about some of these other topics. And I just wanted to thank you. My email is up there if you need to contact me.
Thank you. That was wonderful, and I'm sure there are going to be lots of questions. I've got a couple for you, but I'll wait until the question and answer. It's just amazing how, as a cardiologist, what you said is so true. If you've got a healthy heart, you're much more likely to have a healthy brain, because so much of what we do in terms of recommending lifestyle changes for people to protect yourself from cardiovascular disease is exactly the same thing, to protect yourself from degenerative brain diseases and particularly dementia. So our next speaker is actually, I'd call her a friend of mine. I'm very privileged to say she's one of my patients. And I have heard her, she's spoken in our series before. She did an amazing job. And I asked her to please come back again, because you just heard from Sunnie that a huge part of what we're trying to do here is prevention. Because by the time you wait for dementia to develop and Alzheimer's, then there's a huge, tremendous stress trying to deal with how do we reduce the progress, what can we do. I always tell people, the sooner you start with prevention in everything that's got to do with disease, the better. So I asked Bonnie to talk particularly about this topic. Bonnie practices rehab psychology in New York with NYU, and Rusk Rehab. She offers 17 years of clinical and rehab experience in helping individuals become more successful in achieving their life goals. She's working at Rusk in several positions, including brain injury, concussion, sports performance. She's a licensed psychologist and cognitive therapist. Bonnie particularly enjoys working with individuals in creating strategies that produce the best results for stress, resiliency, sleep quality, exercise, and healthy lifestyle changes. She assists non-athletes and athletes with achieving their goals in mental preparation, exercise, and resiliency. Her special interests include mindfulness, meditation, relaxation therapy, and mental skills training. She's a board member and a running guide of the Achilles Track Club. She's coordinated programs for adults and children with disabilities to help them develop strategies and overcome obstacles that may block their progress. These obstacles include anxiety, depression, stress, and negative self-talk. In 2012, she received a humanitarian award from the National Rehab Association for her compassion and care with persons and disabilities. Bonnie, thank you so much for agreeing to talk to us tonight. We're looking forward to your talk.
So anyway, they find that in Okinawa and also Sardinia, that, just the lifestyle itself, just, people going up and down the stairs. The houses are stacked, so they walk up the steps and they walk down the steps and they do gardening. And so there's physical exercise built into their day, probably the way it was 50 years ago in the U.S., but, before all the computers and electronic age. But, they were just doing little things that added significantly during the day. Kitchens were set up in such a way to avoid overeating. I'm not sure how you do that. I guess you put a lock in the fridge, or maybe in Sardinia, our grandmother stands there and says, "Don't you dare come near this kitchen." So I'm not sure how they do that, but a sense of purpose. I read that in this study, and there's a wonderful book written about the blue zones, Butner, and he wrote that all the elderly grandparents and so forth, they all have a sense of purpose. They're raising the children while the parents go to work, and they all have a sense of purpose, a reason to live, and no one is alone. And I think that's the critical factor, is the loneliness. It's practically non-existent because it's a small community and everyone is supporting each other. Everyone says good morning. Everyone has lunch together. So I think it's the engaged community that really makes a difference. Now, and in addition to this, they found that none of them take supplements, pills, or wine extracts. I wasn't even sure what wine extract was, but anyway, I don't know. Yeah, right. Who needs the extra? But they don't need the supplements and they don't need medication. They take far less pills. And then eating nuts. This is not a commercial for nuts. I don't have stock in nuts. But eating nuts four times a week, 5 times a week, 2 ounces at a time. And the study showed that people who eat nuts tend to live 2 to 3 years longer than people who don't eat nuts, which kind of surprised me. I guess that's without salt, of course, right, Dr. Goodman? So there are long-term fixes that have been shown over and over to add not only years of life, but better years of life. So Sunnie has touched on this a little bit, but some of the brain threats, of course, are saturated fats. Dunkin' Donuts won't like this, but trans fats. Excess iron. That's something that occurred to me by surprise, the excess iron and the excess copper and aluminum, because my father was a chef, and he died when he was 86. And I have some of his original pans. Now, they must be 100 years old at this point, but I was still using them. And my son said to me one day, he says, "How old is this pan?" I said, "I don't know, probably it's well over 80. He said, "Do you realize that you're eating iron every day?" And I just love heavy iron pans to cook in, but a little heavy, but I got rid of it because I realized then that we're probably consuming a little heavy metal here. So
what can you replace it with?
I guess the lighter stainless steel is better for you.
Stainless steel is the safest because copper, if you have an imbalance in your copper and your zinc ratio, it will also affect your risk of getting Alzheimer's. So stainless steel is the safest. There's Teflon coated, and it's been shown that everybody's bodies are full of Teflon, but we don't know is it causing problems or not because no one's looked into it. So stainless steel.
Stainless steel. Okay. All right. That's good to know.
And olive oil.
And lots of olive oil. So brain protectors would be vitamin E, beans and chickpeas, and of course blueberries, we know that, and grapes, and leafy vegetables, sweet potato, and vitamin B12. And for super extra power, we like exercise, and we like an intellectual stimulation, and we like sleep. That would be good. So as mentioned before, what is good for the heart is good for the brain. There's been a number of quite a bit of research on this, and we know that I'm not going to go too much into diet because I believe there's another course on diet alone, just on nutrition, coming soon in your neighborhood, coming soon. And so we know that a good recipe is a plant-based diet, like the Mediterranean diet, regular exercise, smoking cessation, stress reduction, and maintaining a healthy weight. The same is true for Alzheimer's prevention. So in addition to that, we know that blood vessel disease can cause up to 20% of all dementias. And, of course, we know that hardening of the arteries can lead to multiple small strokes, which can impair blood flow to the brain. So how to feed your brain? So according to the Alzheimer's Research and Prevention Foundation, nutrition is critical. The brain is made up of 60% fat. It's the fattest part of our body, and that fat insulates the nerve tracts. So without that, we slow down mentally. And, of course, that helps create the myelin, which transmits the neurotransmitters and the messages between the synapses. But, fresh veggies, and you all have copies of this. There are handouts out on the table, so you have a copy of every slide. So if I don't cover every detail, you have a copy for you out there, and Sunnie's presentation as well. So the good news is that even if you don't do this 100% of the time, that even partial adherence is better than none. And it's never too late to start. Whether it's exercise or proper nutrition, it's never too late to begin. So we know that the American Academy of Neurology has recommended physical activity as an approach for managing MCI, which is mild cognitive impairment. And this is big news. I mean, it's something we've known for many, many years, but now the research validates the exercise piece. And it can make a difference for a person who's having mild cognitive impairment. So growing old is not for sissies. Exercise is good. And we'll talk a little bit more about the type of exercise that's healthy for you. So we know for a fact from the research that it increases plasticity, which is the functioning of the brain, the efficiency of the brain, left to right hemisphere and vice versa, and how if language is impaired from a stroke, how that function can transfer to the right hemisphere. And we know that aerobic exercise can help make that happen, that plasticity. And even the London cab drivers, have that plasticity as well. So it supports learning and memory processes. Some of these studies show that it actually improves memory, even in TBI, even with people with brain injury. And we know that it stimulates formation of new neurons. Now, some people say, well, I thought I was born with just a certain number of neurons. Well, there are neurons that haven't sprouted yet. Believe it or not, they're in the brain. And exercise can promote that. And there's a lot of studies on that. Particularly, the studies are centered around Parkinson's. Reducing your stress and cortisol levels is critical. And the cortisol levels can really, it's important to keep those under check. And then, of course, the BDNF is like a miracle grow for the brain because it repairs cell damage. So we also exercise. What do we mean by exercise? If people are saying, I don't like the word exercise, then I use the word movement. Then just move. Practice movement. It can be any kind of movement you want to do. It can be walking, it can be running, it can be dancing, it can be square dancing. I remember an 88-year-old woman at Rusk who had a hip replacement, and she recovered so quickly, and her mind was so alert. And I said, what is your secret? She said, I square dance every weekend. So, there's something about that. There's something about dance and other exercise. And even North Dakota did a study on Zumba. Does anybody know what Zumba is? Any Zumba dancers here? Yeah? Okay, isn't it great? It's so much fun. So it's the music and the dance that really, it's the motor as well as the sensory as well as the stimulation of music. So other simple things, if people say, look, I work full-time, I don't have time to exercise, we say just park at the far end of the mall, get off the bus early, take the stairs, don't take the elevator. There's a number of things you can do. Walk the dog, right? Walking the dog is great exercise. My dog is my personal trainer. And, walking in the pool, if you're in the pool at the gym, try walking in the pool, ride a stationary bike. There's been a number of studies on Tai Chi, also improving memory and also reducing pain levels, and Pilates and yoga also. And there was a study in Scotland. One group did a walk in the park, and another group did reading a soothing book or listening to music, and they found that the people who walked in the park actually had a boost in their focus and energy and feelings of well-being versus the other two groups. So we know that music stimulates the brain reward centers, and the dance activates its sensory and motor circuits. So now the effects of stress, there's a ton of research on this. Herbert Benson, the cardiologist at Massachusetts General, has done years and years of study on the effects of stress on cardiovascular, as well as memory, as well as other parts of cognition as well. And so it's well documented. And also Manoj Bhasin at University of Massachusetts also has done a lot of work on how meditation, mindfulness can reduce the stress. We know that, but it also reduces inflammation. The NF-kappa B protein that promotes the inflammation. So we know that meditation, mindfulness, relaxation response, all these different forms actually reduce cortisol and reduces inflammation. So, and of course, if you have inflammation, that does increase your risk for dementia. So, I've talked a lot about cognition piece, but also there's the mood. I mean, depression and anxiety is also exacerbated by stress and stress hormones, high cortisol levels, and depression can be a downward spiral, as some of you know, and it can really impact your health in a major way. So a study recently at Mount Sinai found that with meditation practice, there are changes in your genes. Massachusetts General found the same. Manoj Bhasin has done a study in how meditation actually does affect the genes in a positive way. So it doesn't activate that NF-kappa B. But the Relaxation Response is a wonderful book. It's a paperback, doesn't take long to read, by Herbert Benson, so I highly recommend it. So a lot of people say, I don't know how to meditate and I can't meditate. I have a number of friends who say, I can't meditate. My mind is too busy, too active. So our minds are supposed to be busy and active. They're supposed to be chattering monkeys. They are. They just normally operate that way. So you have to, there are different ways to counteract that, to combat that excessive thought. So this is Herbert Benson from his book, is sitting comfortably in a chair or on the floor, being alone in a spot where you won't be disturbed without the cell phone, without the text and emails, and then focusing on a word or focusing on your breath. Focusing on an object. It can be your breath, it can be a candle, it can be anything that will help you relax, or it can be a short prayer. Or it can be a movement, some type of movement. So when other thoughts enter your mind, just acknowledge that you're thinking, and then just let it go like clouds in the sky, and refocus on your mind, on your thoughts. So you don't get carried away with the thought. Like when I first started meditation, I used to plan my dinners. I used to make my to-do list. It took me a long time to get past that and to just let the thought go versus being carried away with it. That's just me, but now I'm able to really let go of that thought. Just acknowledge it that I'm thinking and let it go. The most important thing is with mindfulness too is not judging yourself. So the other piece of this is not only being in the present and focusing on the present, but the second half of it is letting go of the judgment. A lot of people say, "Oh, I'm a lousy meditator," or "I'm not doing it right." Am I doing it right? That's the judgment question. Am I doing it right? So just let go of that. Am I doing it right? And just go with the breath. Focus on the breath. So a number of studies have shown that meditation actually increases the hippocampus. Hippocampus stores memory. That's a good thing. You want a larger hippocampus. That's like the London cabbies. So not only does it enlarge the hippocampus, but it also increases the convolutions in the brain and the cortex. And that's a good thing too. So the more neurons, the better. And so they've proven that meditation does that for you.
Especially since stress kills hippocampal brain cells where your memory is. This is a wonderful alternative.
I was going to do a meditation exercise. If there's time at the end, I will. I was going to do it here, but you know what? I'm worried about the time. So, but I did print out a card for you, and there's a card on the table outside if you don't have it already, on how to do mindfulness meditation. Okay. So the next part is use it or lose it, basically lifelong learning. So brain stimulation keeps you young. As I mentioned before, take a course, do something different, do something new every day. I've told my husband, right, that do a first every day. Whatever it is, just do something that you've never done before. Go to a different restaurant, order a different coffee, do something different, something new. Learn a fact that you've never learned before. Use that fact. In your day, and so we know that the brain constantly rewires itself. Learn an instrument too. Learn how to play an instrument. Learn how to dance. Join a book club. Play bridge. I tested a woman who was 90 once, and she said, "I'm really concerned because I think I'm starting to lose my memory. I'm starting to forget things." And I'm thinking, starting. I'm like, for me, it's like, oh, it started a long time ago. And I gave her the digit span, which is repeating the numbers in order. And then you have to do them backwards, and then you have to do them sequentially. And she got everyone right. And I said, "Can I ask you a question? Can I ask you how you did that?" She said, "I play bridge. And every time you gave me a number, I visualized a card." So I thought, oh, I'm going to take bridge lessons. So when I have time. So the power of sleep. Sleep is very critical. And I know it's not easy to get sleep, when, as life changes over the years and aging, more trips to the bathroom, etc. It's a little tougher to get 8 hours of sleep, 7 hours of sleep, even 9. But there is compelling evidence that poor sleep can definitely make a difference, because the garbage in your brain that Sunnie referred to earlier, all of that is cleared out, during sleep. It's in the cerebral spinal fluid. So, that fluid circulates through and it cleanses your brain. So the more, sleep is important during that time. And we know that the beta amyloid protein believed to trigger Alzheimer's can be a channel. That can be a channel when there's lack of sleep. That's a real serious if it's a sleep deficit. So also there are links between sleep, beta amyloid, memory, and Alzheimer's, according to Berkeley Neurosciences. So obviously restorative, undisturbed sleep is the best part if you can do it, if that's possible. That cleanses the debris and it plays a part in the appetite and fat storage. And by the way, blue zones, they get the 8 hours plus. I think I'm moving to Sardinia. So Well, okay, this is just a graphic. It's in your handout, so I won't go through it all. But we all know some of the effects of sleep deprivation. I'm sure everyone here could just go through this list. And all right, so included in the handout is also, and I won't go through each one, but establishing a bedtime ritual is really important. One of the things that I learned at when I went to a workshop at Harvard Medical School recently, they said one of the recommendations, because they were explaining the VA program, the new VA Holistic Health Program, which is a major shift in the VAs, but they said set an alarm to go to bed. I mean, that really hit home with me, was, setting an alarm to go to bed. That's what I need. That's what I need. So, and, trying to go to bed at the same time every night is important, avoiding heavy meals 2 to 3 hours before bedtime. A lot of these things we know, but now we have the evidence to back it up, so which is nice. Using a white noise machine, or I have an air freshener, air cleaner, dim light, and do not have your computer on in the room where you sleep, because it will come on at 4 a.m. Mine has, and it wakes me up. So I've learned the hard way, and don't read at night from a backlit electronic device, because it does interfere with melatonin, the production of melatonin. So we have found that the blue light from computers and iPads and laptops and so forth will interfere with melatonin, which helps you sleep. Of course, temperature in the room is important too. Some people like it much, much cooler. Okay, and finally, a social network. One of the key studies, Harvard had done a 75-year longitudinal study. Needless to say, there were a number of directors. They had to keep replacing the director. But it was 75, a long study, and they found that what really matters near the end of life, what really matters in later years, and that is social connection. Social connection is everything. And it could be a friend, a neighbor, it can be a relative or maybe non-relative, but just having someone that if you have a problem, you can go to that person, whether it could be a neighbor. Just having a connection of 1 or 2 or 3 people that you feel close to, that you can talk to, and you can share common problems with. But it's just someone that you can feel at ease and call upon for help. That is the most important thing. And also, as the amount of pathology increased, they found the apparent protective effect on cognition also increased. So it's not just about reducing pathology, but it's also about protection on cognition, having that social connection, some type of social connection. Yeah. Okay. Alrighty. Oh, I'm right on time. Okay, and of course, part of his attitude also. My mission in life is not merely to survive, but to thrive, and to do so with passion, compassion, some humor, and some style. So that's Maya Angelou, and I think that these are additional resources. And that's all, folks.